I'm Wale Olarinde, a consultant ear, nose and throat surgeon, usually referred to as ENT surgeons. Ear, nose and throat surgery is a very broad specialty treating all age groups from babies all the way through to senior citizens, and I have a broad practice treating a wide range of ENT conditions. I am a Fellow of the Royal College of Surgeons of England and on the Specialist Register of the General Medical Council to practice ear, nose and throat surgery. I can see your ear. My NHS practice is based at Sheffield Royal Hospital in North Derbyshire, while my private practice is based at the Chatsworth Suite in Chesterfield and Thornbury and Claremont Hospitals in Sheffield. My subspecialty interest is treating people with head and neck cancers, which essentially includes a lot of the cancers above the collarbone, with the exception of the brain.
But I also get like a bit of a pain here, and I try things, over the counter, sort of indigestion, all the usual things.
My practice is best described as a general ENT practice with a specialist interest in head and neck cancer patients. I therefore treat children with common ENT problems such as tonsils, adenoids, nosebleeds, glue ear, and hearing problems.
The thing that we were concerned about with Ruben was whether he'd got sleep apnea. I think, he did the examination and said yes, his tonsils are enlarged, but it was ruling out whether there was an underlying condition that would affect like weight gain. So that was the thing he wanted to rule out. From the moment we went in, he was very professional but also very friendly. And just a great experience really through the whole thing. I think he just really listened to us, which was what we liked. We felt like he really took on board our concerns and was very, very clear on like what he was going to do and what have you. But he was brilliant, really good.
Yeah. So I'm going to grab your head, swing it around this way very swiftly and take you all the way down. Okay. I also treat adults with ear complaints such as ear infections, perforated eardrums, vertigo, dizziness, hearing loss, wax problems and tinnitus.
Well, I had a really bad ear problem that had been ongoing for a few days, and it was late one night and it was really, really painful in my ear. I'd never really have had ear problems before, so it was complete unknown territory, so he explained it in a huge amount of detail about what was going to go on, what he was actually going to do to my ear and what he thought the problem was, so I was left completely reassured with everything. Okay. Absolutely superb, we covered everything in a huge amount of detail. He diagnosed obviously everything correctly.
So when you can't hear perfectly, it's not as though it goes off completely. People with blocked noses, sinus trouble, hay fever, snoring, sleep apnea and facial pains also get treated in my practice. I see patients with voice changes, sore throats, feeling of something stuck in the throat, recurrent tonsillitis, bad breath, swallowing difficulties and neck lumps including salivary gland disease.
Okay, perfect, yeah.
Removing skin lesions, reshaping the nose after trauma, repairing split or gouged earlobes, or pinning back protruding ears also falls within my expertise.
The treatment I received from Mr. Orland at ENT Sheffield was more than good. I was very relaxed with him and very happy. I had a problem with my throat. I couldn't swallow or eat properly, and that was what we were dealing with. It was very quick to diagnose that. He gave me some tests in the consulting room and looked at the things and showed it up, and he found out straight away what my problem was. Since I've had the operation, it has brought me back to normal. I can eat anything at all and my life has gone back to normal. I'm quite very happy with the outcome of the operation.
My area of expertise is managing patients with various forms of throat and neck cancers. Throat cancers are not common in the general populace, although I see patients with this condition a lot. They can sometimes be complicated and tricky to treat, and so an early diagnosis is the first key to achieving a high chance of cure. Persistent symptoms, those lasting longer than 4 weeks, should be seen to promptly. These include sore throats, voice changes, neck lumps, swallowing difficulties, a lump in the throat, discharge from one side of the nose, particularly with a nosebleed, unexplained tooth mobility, mouth lumps and non-healing mouth ulcers. It looks absolutely okay.